Hello, nice to meet you today. Okay, so let me introduce myself. I'm the pharmacist on duty for today. My name is Bo Shi, and if you wish, you can call me Jerry. Okay, and may I know your name, please?
My name?
Yeah.
My name is Mickey Chen.
Mickey Chen. May I have your health insurance card?
There you go.
Thank you very much. And your birthday?
I was born on 1917, January 1st.
January 1st. Wow, so lucky, yeah. And this is your health insurance card. Please put it carefully. And then, why do you come to the counseling room for today? Is there anything that I can help you?
Okay, I need to know my research for my patients.
And what kind of medications do you bring your bag of, like,
What's
some bags that includes your information about the medicine? Do you bring your medicine here?
Yeah.
Here. Okay, thank you very much. And is there all of you are for the first time, or have you ever eaten these medications before?
Sir, explain to me.
Explain it to me. And do you know that what's happening to you this time, and why did the doctors prescribe them to you?
All I know is I was diagnosed as kidney disease.
Kidney disease.
Recently, the gout flare.
Gout flare. Okay. And do you have like hypertension?
Yes, I have hypertension and hyperlipidemia and hyperuricemia.
Okay, got it. Great. And before we dig into these medications, I'm going to ask you some questions to help me know more about your information.
Okay.
Okay? So are you allergic to any foods or drugs
No, not at all.
or any like pillows?
No.
No, great. And except these medications, have you ever eaten any other drugs now or before? No? Okay, that is perfect. And you do, except for the hypertension, hyperlipidemia, and as what you have mentioned before, have you ever had any other diseases before, like G6PD deficiency or anything like that? Okay, got it. And are you currently eating any Chinese drugs, herbal medicines, or dietary supplements?
No.
No. Okay, and that is pretty great because this may cause some interactions with your drugs. Okay, that is pretty great. And let's look at the drugs the doctors prescribe for you today, okay? So the first question of you is about diabetes. Do you have diabetes, right? Yes, diabetes. And these 1, 2, 3, the Loditan, Toujeo, Forxiga, these 3 are prescribed for your diabetes. Okay, so let's look at the first one, the Loditan. You eat one tab once or twice in a day. What do you think? No idea? No idea. Okay, so you need to eat for this drug 2 times in a day. Okay, that means breakfast and dinner. Okay, 2 times in a day. Loditan. And the second is Toujeo. That's a little bit complicated because you have to inject this by yourself. Okay, so as you can see, here is a pen here, and then when you use it, you need to add the needles on it. Okay, have you ever used this pen before? No. Okay, so you need to use that once daily before you go to sleep. And then you find a place maybe like somewhere in your stomach. This is a perfect place. Or like if you think stomach is not good, hands everywhere in your body is okay. Put your needles on and then put it on your stomach. And then, for example, I will use my hand as an example, okay? To do like this, just like keep your skin up, and then you use your pen to stick inside. Quite easy, yeah? One time before sleep. Got it?
Okay.
Am I speaking too fast? Or it's okay? It's okay, great. And the third one is Forxiga. This one is also a diabetes drug. And it's preferred, like for example, you eat at breakfast, only one time. So if I see these drugs, if you only need to use it one time, I suggest you use them in the morning to prevent you forget. Like, okay. So have you ever like forget to eat drugs before?
Yes.
Often, okay. So like,
Because I have no any discount, so I didn't take medicine.
okay. I got it. Yeah, these drugs are too much. You know, I believe these are too much and may like you don't feel any illness, right? You are not coughing, you are not having a fever. Why do I need to use these drugs? Okay, later I will explain how these drugs works for you. And first of all, I'm just suggest you these drugs are really important, and you can set an alarm in the morning. Yeah, and if it is only prescribed once daily, you can eat them before or after breakfast. Okay, and for example, like this one for Zika, I know you are prescribed with a kidney disease, right? This one, although it is a drug for diabetes, this one is also has a kidney protective effect. That means it can protect your kidney. Yes, it is recently proved it has this function. So if you eat this one, it is not only helpful with your diabetes, but only helpful with your kidney. And do you know what will be going on if your kidney is not doing very well? Do you have any ideas? If your kidney is not working well, what will happen next?
I don't know too much.
Okay, so currently your kidney is not really bad, but if your kidney keeps worsening, if you don't eat these medicines, and your kidney will keep worsening, then you may need a kidney transplant. Have you ever heard this now before? A kidney transplant? Okay, or transplantation. That means you need to visit visit the hospital 3 times in a week. You know what? 3 times in a week. That means, are you currently working? Yes, and you need to like take a day off or have a day off, and then you may need to visit the hospital really often. That is really bothering, right? Yes. So I think it is really helpful to eat these medicines to prevent your kidney from being worsening.
Okay, I see.
Yes, and it is really helpful if you set an alarm, like when you wake up, and then you set another alarm to notify you to eat this medicine. Great. And then we have 4 drugs for hypertension. That is the Forflow, Diovan, Dilaton, and Dosaban. And these are all once daily, 1 tab once daily in the morning. That is quite easy to help you lower your blood pressure. Okay, blood pressure all has playing an important role in the kidney part, in the heart part. So these diseases you have currently is all corresponding with each other. So we cannot only just treat one disease, we may need to treat all the diseases. And I see you are a little bit like heavy. May I help me know how heavy you are?
I would 100 kilograms.
100 kilograms.
Yes.
So yes, and maybe you can try some lifestyle modifications to help you lower your body weight. And then maybe you won't need to eat that much medications from now on after that. Okay? So like keep doing some exercises and eat healthy foods. Yeah, and then about this drug, calamate, it is helping you to lowering your potassium level. And then you can eat some apples. I'll give you a hint. An apple a day keeps the doctors away. So you can eat apples, pineapples to help you lowering your potassium level. And this drug, you may not need to use this drug anymore. Okay, so you can see that lifestyle modification is really important.
Again?
The calamate.
I don't need to use this. What's this?
This one is a drug that helps you to lower your potassium level. Okay, you are currently having a high potassium level, and you may feel any discomfort about it.
Okay, thank you.